Hi there, you're welcome to DamiRx Care channel today. Thank you so much for checking us out for your medication needs today, and we would love for you to be a part of our community here at DamiRx Care. In order to do that, make sure you hit that like and subscribe button down below, and also you can check out our free recipe to one of our diet plans here at DamiRx Care by clicking on the link below, and it will direct you to how you can download that recipe for that diet plan that we do have on our website. Thank you so much for checking us out again, and please stay tuned. Hi there. So let's jump right into our medication of choice today. So our medication of choice today is known as Jardiance. So the generic name of Jardiance is called Empagliflozin, and this medication actually belongs to a class of medication known as the SGLT-2 inhibitors. So the way this medication works is it kind of increases how much your kidney is able to filter that sugar away from your blood. That way we're able to keep your blood sugar under control. So let's talk about how this medication is used. So this medication is used in patients who have type 2 diabetes. So normally patient will start with a 10 milligram tablet and then slowly move up to a 25 milligram tablet, depending on how well they are tolerating the medication. So this medication can also be helpful in patients who have a history of heart failure and also have type 2 diabetes. So what are some of the side effects to look out for while you're on this medication? So some side effects of the medication include increased urination. It can cause increased thirst. It can cause nausea, upper respiratory infection, as well as joint pain. So if you remember, as I said earlier, this medication works through the kidneys mainly to kind of help filter out more of the blood glucose in order for your body to be able to get back to its regular amount of blood glucose that's supposed to be in your blood, and also kind of help regulate the amount of blood glucose by filtering out some of those glucose that's in the blood. So what are some serious side effects in order for you to be able to reach out to your doctor appropriately and say, hey, I'm noticing this serious side effect. I think we need a change in my medication. So those serious side effects includes recurrent UTI. So some patients have noticed that while they're on this medication, they're getting recurring urinary tract infection. If this is the case, you want to make sure that you're reaching out to your doctor immediately. That way, they're going to see if there's another substitute for you to take that's going to prevent or avoid you from keeping on getting this UTI infection. Also, if you start noticing any recurring genital fungal infection, you want to make sure you're bringing that up with your doctor. If you start noticing a lower blood pressure, you want to make sure you're bringing this up, as well as high ketones or acid in when you test your ketone level. You want to make sure that you're reaching out to your doctor as well. Or if you start noticing changes in how much you urinate, or how much you're using the bathroom. Like I said, a common side effect of the medication is increased urination because of that filtering that's going on. You are most likely going to be using the bathroom quite often in order to urinate. But if this is something that is consistent and you're not able to cope with it, then you want to make sure that you're reaching out to your doctor in order to see if there are other substitutes that they can recommend for you. Also, another serious side effect of this medication is what they call Fournier's gangrene. So this is like a skin or tissue damage around the anus and the genital area. So if you start noticing any abnormal irritation around this area, make sure that you're reaching out to your doctor for them to be able to make sure and rule out that it is not this medication that is causing that. All right, so what are other things that you need to look out for? And this doesn't take away from the medication. As I said, side effects is a two-way street. It's either you see it or you don't see it. If you start seeing it and it becomes bothersome for you, then you want to reach out to your doctor and say, hey, I'm not able to cope with this side effect. What are my other options? All right, so what are some other things, as I said earlier, that you need to know while you're taking this medication? So if this medication is working great for you, you love it, make sure that you're drinking plenty of water. As I said, you will probably be urinating more often than normal. So make sure that you're staying hydrated. That way, as you're getting rid of some of that urine, you're also taking in more water or more fluids in order to stay hydrated, and in order to prevent any form of low blood pressure while you're taking this medication. Also, this medication is preferably taken in the morning. That way, you're not using the bathroom quite often at nighttime, and it kind of takes away from your sleeping period. All right. Also, with this medication, you want to make sure that you're keeping your doctor's appointment. That way, they're able to check your A1C, they're able to check your blood glucose, your blood pressure, to make sure that this medication is not affecting any other organs in your body other than, the way your body is producing so much glucose that is, that's later on might affect or cause some complications due to the diabetes. All right, so this medication is not appropriate in patients who have kidney disease. So in patients who have kidney disease, they already have some underlying condition or, something going on with their kidneys. This medication works through the kidneys. So if your kidney is already having issues, you don't want to put additional pressure on your kidney in order to be able to filter that blood sugar. So there are other medications that you can try if you do have some form of kidney issues or kidney failure or kidney disease going on. That will be preferable for that condition other than this medication. All right, so I hope I was able to help you in terms of 1 or 2 things to look out for while you're taking this medication. If you do have any questions, make sure you check out our website at www.damiarxcare.com. Thank you so much for watching, and please stay tuned.